Good day, learners. I am Farinemi by name. Today we'll be discussing a disease condition that is known as pancreatitis. So before I continue, I want you to write within the comment section what you understand by pancreatitis. So before we dive into the disease condition in details, let's quickly remind ourselves the anatomy of the pancreas so that we can have an in-depth knowledge about what pancreatitis is. Now, the pancreas is located in the left upper quadrant of the abdomen, and it has different organs that are surrounding it. So it is next to the duodenum because it has a relationship with it. It is next to duodenum because pancreas, we all know, it is both an endocrine and exocrine gland. So it has a relationship with the duodenum. Now, inside the pancreas, we have specialized cells that secrete enzymes and hormone. Inside the pancreas, we have 8 acinine cells. So these acinine cells, they are the ones that secrete digestive enzymes. But those digestive enzymes are inactive by the time they are being secreted. So these digestive enzymes, they are not activated until they get to the duodenum, where they are meant to play a role in digestion. Now, these 8 acinine cells, they secrete amylase that breaks down carbs to glucose. They secrete protease that breaks down protein, then lipase that breaks down fat. Then another important cell in the pancreas is the islet of Langerhans that plays a role in secretion of in production of insulin, glucagon, somatostatin, and pancreatic polypeptide into the bloodstream. So this is the endocrine function of the pancreas. It plays a role in production of all these hormones. Then another important thing that you need to know about the pancreas is that we have epithelial cells that surround the pancreas. So it is these epithelial cells that secrete bicarb and fluid. What is bicarb and fluid? What they do is that they make production the enzymes that are being produced by the pancreas to be less viscous. Because if these produce are thickened, there is tendency that they are going to block the pancreatic duct. So that is why these epithelial cells help to secrete bicarb and fluid. Now let's go to the definition of pancreatitis. Pancreatitis is the inflammation of the pancreas, and we have 2 types majorly. We have the acute pancreatitis. From the word acute, we know that, this is sudden inflammation. It is occurring suddenly. And this is very common in patients that take alcohol a lot. And the major cause is gallstone and alcohol. Gallstone, this is known as cholelithiasis. So this gallstone occurs when there's a lot of accumulation of salts, then undissolved cholesterol. So all this can accumulate together to form gallstone. It can accumulate together to form gallstone. Then alcohol too can cause acute pancreatitis. Alcohol has a way of damaging the cells within the pancreas. And once these cells are damaged, I told you that earlier on that they play a major role in production of enzymes. They also help in production of hormone. So once the alcohol damages these cells, even if they produce this particular enzyme, there is tendency that the pancreatic duct will be blocked. And once the pancreatic duct is blocked, what will happen? The enzymes will be within the pancreas. It will get to a time, it will become activated. And once it is activated, what will happen? It will begin to digest the pancreas. The pancreas will swell up, it will become inflamed. We call it autodigestion. So it will digest the pancreas, and the pancreas will become inflamed. And if something is not done as soon as possible, it can lead to permanent destruction. It can lead to permanent destruction of the pancreas. Now, in acute pancreatitis, please, I want you to take note that the pancreas is still functioning. Not that the pancreas has packed up or it has lost its function. There is just a sudden inflammation. You carry out a lab investigation, there will be excessive high level of amylase and lipase in the bloodstream because the pancreas is still working. So please take note. Now, due to the location of the pancreas and how it surrounds other organs, when it is inflamed, there is probability that digestive enzymes that are trapped within it, they will begin to flow out to other organs and vessels. And this can affect those organs and vessels. This digestive enzyme they will begin to damage the organs. It can find its way to the lung, causing acute respiratory distress syndrome. Then it can also affect vessels, causing what? Bleeding. So that is why in the patient with acute pancreatitis, you will see a sign that is known as Cullen sign and Great Turner sign. So we'll still discuss that later on. Then this condition is reversible if treated properly. There is limited structural change to the pancreas. It can lead to chronic pancreatitis if it is not treated. Now let's go to chronic pancreatitis. Chronic pancreatitis occurs due to repeated episodes of acute pancreatitis. Let's say someone is abusing alcohol over and over. That person initially might start having acute pancreatitis, but over time, if there is repeated exposure of the pancreatic cells to this alcohol, then they might be damaged, they might be destroyed. They might be destroyed permanently. So it might lead to permanent damage. Now let's talk about the cause. We have years of alcohol abuse. If someone has been abusing alcohol over the years for a long period of time, then another major cause is cystic fibrosis. This cystic fibrosis is a major disease condition that affects the respiratory system. Now, how can this cystic fibrosis, how can it cause pancreatitis? So now, this patient with cystic fibrosis, there are major risks for chronic pancreatitis because they lack a protein that is called CFTR. So this CFTR protein, what it does is that it helps to maintain, it plays a role in the movement of chloride ion. It helps in It plays a role in the movement of chloride ion to help balance salt and water in the epithelial cells. So it helps to balance salt and water in the epithelial cells, and it is this epithelial cells that lines the duct of the pancreas. So there is decreased production of bicarbonate secretion by the epithelial cells. So immediately there is problem. In the patient with cystic fibrosis, this protein plays a very important role in the body. But unfortunately, when patients have cystic fibrosis, the protein that plays a role in movement of chloride ion, it is not present. They are lacking it. So once they are lacking it, this protein that plays a role in movement of chloride ion is not present. And once it is not present, that means we have problem with movement of chloride ion. And there will not be a balance between salt and water in the epithelial cells. I told you that it is the epithelial cells that produce They produce bicarb and fluid to make pancreatic enzymes to be less viscous. So immediately this is lacking, then there will be problem. So immediately we have this problem, there is decreased production of bicarbonate secretion by the epithelial cells. And once there is no production of bicarbonate and fluid, what will happen? Definitely it will lead to thick mucus in the pancreatic duct. There will be excessively thick mucus within the pancreas. And once these mucus are present, what will happen? There will be blockage of the pancreatic ducts. There will be blockage of the pancreatic duct, which can cause digestive enzymes to activate. Once the pancreatic duct is blocked, the enzymes will not be able to find their way to the duodenum, and they will become activated. And over time, they will damage the pancreas. So the pancreas will experience fibrosis. It will experience fibrosis, and they will no longer produce digestive enzyme to help with food digestion. Now let's talk about other causes. We have infection, trauma, tumor, autoimmune medication like furosemide, thiazide diuretics, azathioprine, hypercalcemia, hyperlipidemia, hyperparathyroidism, ischemic vascular disease, peptic ulcer disease. So you can read about these causes. How can they cause pancreatitis? Take for instance, in hypercalcemia, they believe that excess calcium can block the pancreatic cells, can block the pancreatic duct. Now let's go to the pathophysiology. Pancreatitis is the inflammation of the pancreas. This inflammation occurs for some reasons, making the cells that secrete hormones and enzymes to become irritated, and they will start malfunctioning. We have discussed about the causes in the previous slides, so we are not going to talk about that again. So this leads to digestion of the pancreas by its own enzyme. This particular enzyme, they become activated within the pancreas, and once they are activated within pancreas, they will lead to They will lead to inflammation of the pancreas. With time, there will be irreversible structural damage to the organ, especially in a chronic pancreatitis. If something is not done, definitely it can lead to chronic pancreatitis. So normally enzymes are not supposed to be activated until they get to the duodenum, where they experience biochemical change with the assistance of stomach acid. So an inflamed pancreas is unable to deliver enzymes. They will not be able to produce enzymes. They will not be able to secrete hormones properly into the what? Into the duodenum. So this results in the swelling of the pancreas, and this leads to what? Leakage of digestive enzymes into the surrounding tissues and organs. I've explained all this just like a summary. I've explained all this in the previous slides. So it will begin to what? These digestive enzymes, they will begin to leak into the surrounding tissues and organs, and it will begin to what? Damage them. So these are the signs and symptoms that you can see in a patient with pancreatitis. This will result in blood sugar issues. And we all know the reason why, because insulin that helps in regulation of blood glucose is not being produced. Patient can have ascites. I told you earlier on that there will be leakage of digestive enzymes to the surrounding tissues, and it will begin to damage those organs. So it can lead to accumulation of fluid within the peritoneal cavity. There will be malabsorption for sure, because the digestive enzyme that is supposed to help in the breaking down of food is not available. So how will the patient get nutrients? Then another thing is abdominal pain. There is inflammation, so definitely there will be what? Abdominal pain. Patients can have diarrhea. Patients can also what? Experience shock, because the inflammatory process is what is going on. Respiratory distress can occur if these what? If these enzymes that are seeping out find their way to the lungs. Then internal bleeding. These digestive enzymes that are seeping out to the surrounding what? To the surrounding organs and actually affecting the organs. They are damaging it. So it can lead to internal bleeding. So this internal bleeding, we call it Cullen and Gray Turner sign, because it will be visible on the patient's skin. So we are still going to get to that part. Now, it can lead to fibrosis, cyst, abscess, and then rupture if something is not done. So this is the diagram of the pancreas. You can see we have the common bile duct here. We have you can see the acinine cells that helps in production of what? Digestive enzymes. You can see them. Look at the acinine cells. They are the one that helps in production of what? The digestive enzymes. Then we also have the what? The islet of Langerhans. It has the beta cells that produces what? The insulin. You can see where the common bile duct is connected with what? With the ampulla of beta. You can see that it is leading into the duodenum. So now, if this pancreas is inflamed, so definitely these enzymes, they will not be able to find their way into the what? Into the duodenum. You can also see the pancreatic ducts. These pancreatic ducts are not supposed to be blocked for any reason. This is another better diagram for you to understand what I'm saying. This one has the gallbladder that stores bile temporarily, because bile helps to what? It helps to emulsify fat. So it is this gallbladder that stores the what? That stores the bile that is being produced by the liver. So this one has the pancreatic duct. Yeah, you can see the duodenum, the ampulla of beta, and the common bile duct. Now let's go to the signs and symptoms. What are the signs and symptoms we are going to see in a patient that has pancreatitis? There will be abdominal pain, including a sudden onset at the mid-epigastric or left upper coronal location with radiation to the back. Then pain is aggravated by fatty meal. So when the patient with pancreatitis, once they take fatty meal, then they begin to complain of pain. So their pain is usually aggravated by what? Fatty meal, or if they take alcohol, or lying in a recumbent position. There's restlessness, anxiety, low-grade fever, abdominal tenderness, distension, gagging. There's gagging of the abdomen. There is nausea and vomiting. There's weight loss and dark urine. Now there's absence or decreased bowel sound, elevated white blood cell counts, because inflammatory process is going on. There's elevated glucose level because there is no insulin that will help to control the what? The blood sugar. There's also what? Accumulation of bilirubin. There's accumulation of bilirubin. There's alkaline phosphatase, elevated level of bilirubin, alkaline phosphatase, urinary amylase level. I told you that there will be high level of what? Amylase, especially in the patients with acute pancreatitis, because the pancreas is still working. Then there's elevated serum lipase. Okay, I've said that earlier on. Then Cullen sign and Gray Turner sign. There is also cysturia. This cysturia is known as what? Fatty stool. The fat is not being broken down. the bile that is supposed to help cannot even find its way out. So there is what? There is steatorrhea. That is what? Fatty stool. Now look at this picture. This picture is showing us what is known as gray toners and Cullen sign. Gray toners and Cullen sign. So this particular Cullen sign can be seen. There is like a bluish discoloration around the umbilicus. So this is usually seen in patients with pancreatitis. You will notice a bluish discoloration around the umbilicus, which shows that there is an internal bleeding, which shows that a particular organ has been damaged. You know, I told you when we were talking about the pathophysiology that once the pancreas is inflamed, then the digestive enzyme they will begin to seep out into the surrounding tissues and surrounding organs, and they can damage this organ, leading to what? Bleeding. So this bleeding can be seen on the patient's what? On the patient's abdomen. So this bleeding can be seen underneath the skin as what? Bluish discoloration. So it is this particular bluish discoloration that is showing around the umbilicus. We call it Cullen sign. Then another thing is what? Gray toner sign. So I usually remember this gray toner sign with the word T, letter T. So when you if you ask someone to turn, when you ask your patient to turn, that's toner. So you're asking the patient to turn. If the patient do not turn, you cannot see that particular sign. You will not be able to notice it. So you have to ask your patient to turn, because it is usually, this particular bluish discoloration is usually seen around the flank. And there's no way you can see the patient's flank until you ask them to turn. So when you hear gray toner sign, just remember that, you have to ask the patient to turn first before you can see. So that means there is bluish discoloration around the flank. There is bluish discoloration around the flank. While Cullen sign, you notice that this particular bluish discoloration around the umbilicus. So that is the meaning of gray toners and Cullen sign. So please, you should be able to differentiate gray toner sign from Cullen sign. Now, how can you diagnose pancreatitis? Through blood tests. I said earlier on that in acute pancreatitis, there will be high level of what? Increased level of amylase and lipase. There will be elevated blood glucose, elevated what? Bilirubin. There is elevated coagulation time. The WBC will be over 10,000. The normal WBC count should be between 5 to 10,000. Some will say 4 to 10,000. But once it is over 10,000, then you know that, an inflammatory process is going on. There is elevated electrolytes here. All the electrolytes will they will go up. The calcium will go up, magnesium level, excessive high level of all these electrolytes. There will be electrolyte imbalance. Then patients can also do what? They can do CT scan. Then there's something we call ERCP, endoscopic retrograde cholangiopancreatography. Endoscopic retrograde cholangiopancreatography. So we use this particular ERCP to diagnose pancreatitis. Can be used to diagnose pancreatitis. You can read more about it. And sometimes it can be used to treat pancreatitis. So they assess the pancreas, bile duct, gallbladder with scope. With scope. Now, let's go to nursing management. What are the nursing management? What are your roles when it comes to managing a patient with acute pancreatitis? You have to make sure that the patient is on MPO. Someone who has acute pancreatitis, you don't want to give that patient food at that particular time, because you need to rest the organ. We don't want to subject that organ to what? To more suffering. We don't want to subject it to any pressure at that particular time. So you need to put the patient on what? MPO. So we will take food and fluid during the acute period, because we want the pancreas to rest. Then you have to maintain hydration. The patient is on MPO, so definitely you have to provide another source of nutrient to the patient, which means you have to put up IV fluid as prescribed. Then you administer parenteral nutrition for severe nutritional depletion. Administer supplemental preparations and vitamins and minerals to increase caloric intake prescribed. Then an NG2 may be started if the client is vomiting, or if the client has biliary obstruction or paralytic ileus. Administer opiates as prescribed, because these patients are what? They're having serious pain. They're in pain. So you have to make sure that, you give them pain relief. Administer H2 receptor antagonists or proton pump inhibitors as prescribed to decrease hydrochloric acid production. and prevent activation of pancreatic enzyme. The pancreatic enzymes, they will be what? They will be activated with time if they do not find their way to the duodenum. So this H2 receptor antagonist is to help to decrease hydrochloric acid production and also to prevent activation of pancreatic enzyme. You have to monitor for significant changes in their vital signs. There is an inflammatory process going on. These patients are also prone to what? Prone to shock. So you want to monitor their respiration, their pulse rate. You want to monitor their blood pressure. So once it begins to what? Once it begins, the blood pressure begins to get low. One patient begins to have hypotension, then you start suspecting. The heart rate goes up, the pulse rate goes up, then you start suspecting shock. Then observe for changes in behavior and level of consciousness that may be related to alcohol withdrawal, hypoxia, or impending sepsis with shock. Then instruct the client in the importance of avoiding alcohol. You have to educate this patient. It is important for them to do away with alcohol. Patients should not tell you that, okay, I will reduce my alcohol intake to 2 cups per week or to 2 cups per day. Patient has to do away totally with what? Alcohol. There must be total abstinence from alcohol. So instruct the client in the importance of follow-up visits with the primary healthcare provider. Instruct the client to notify the primary healthcare provider if acute abdominal pain, jaundice, clay color stool, or dark urine develops. So now let's go to nursing management of chronic pancreatitis because they're a little bit different from each other. You have to instruct the client in the prescribed dietary measures. Fat and protein intake should be what? Should be limited. If this patient takes fatty food, how do you expect this patient to get the food digested? So you have to limit it because once this patient takes fatty food, what happens? Their pain becomes what? Aggravated. Their pains become aggravated. And I think you know the why from the pathophysiology that I explained earlier. Then instruct the client to avoid heavy meals. Patient has to what? Avoid heavy meal. Instruct the client about the importance of avoiding alcohol and avoiding caffeinated beverages. Provide supplemental preparations and vitamins and minerals to increase caloric intake. Instruct the client to eat small meals and snacks high in calorie. Administer pancreatic enzymes as prescribed because this patient is lacking what? Pancreatic enzymes. This pancreatic enzyme, even if they are produced, they are not doing what they are supposed to work, what they are supposed to do. So this patient can be administered pancreatic enzymes as prescribed to aid in the digestion and absorption of fats and protein. Now, this pancreatic enzyme, there are ways of what? Administering it. There are rules to it. What is your nursing management when it comes to administering pancreatic enzyme? This pancreatic enzyme should be administered with food. You should give it with food. So it shouldn't be given 30 minutes before food. You don't give it 30 minutes after food. So immediately your patient wants to eat, then this pancreatic enzyme should be administered. And it can also be administered with what? Apple juice, like acidic drink. Any drink that is acidic or apple juice, it can be what? It can be administered with it because it helps in quick absorption of this particular medication. So that pancreatic enzyme is just like a medication. You are replacing this particular pancreatic enzyme. It's just like you are administering it externally to replace that digestive enzyme that the patient is lacking. So immediately you want to administer this pancreatic enzyme, you make sure that the patient takes it with what? With food. It is not given before or after. It has to be given together with the food. Now, administer insulin or oral hypoglycemic medication as prescribed to control diabetes mellitus because definitely there is lack of insulin. So this patient, there is tendency that this patient is going to have hyperglycemia. So instruct the clients in the use of pancreatic enzyme medication, which I told you earlier on, that it has to be taken with food. Instruct the client in the treatment plan for glucose management. Instruct the client to notify the primary care provider if there is increased dysuria, that's fatty stool, abdominal distension, cramping, or skin breakdown develops. Instruct the client to restrict activity to one floor until strength is regained. Emphasize the importance of follow-up visits. Now, what are the complications? There might be necrosis. So if acute pancreatitis is not treated as soon as possible, then patients might have abscess necrosis. It can lead to chronic pancreatitis. It can lead to acute respiratory distress syndrome and peritonitis. Now, quiz time. I want you to answer this question. Please write in the comment section. What do you call the ecchymosis on the flank of a patient? So please don't joke with this quiz. Take time, look at it very well, answer this question because it will help you. It will enhance your knowledge on what? On pancreatitis. So what do you call the ecchymosis on the flank of a patient? Write in the comment section. What do you understand by Cullen sign? Are the following lab values, are they going to be increased or decreased with pancreatitis? So these particular lab values that you are seeing on the screen, in a patient with pancreatitis, are these lab values, are they going to increase or decrease? Glucose, what will happen to glucose? What will happen to calcium, amylase, and lipase? So please write in the comment section. Are their level going to increase or is going to what? Decrease? So thank you for listening to this lecture. Please make sure that you listen to this lecture from beginning to the end because it's going to work. It's going to benefit you. Thank you and have a lovely day. Bye. Best of luck.